to do that safely, we're certainly seeing the economy starting to open back up. So the real challenge right now is we're hopefully getting to the final stages of this, is that we have got to make sure that the people who have not been vaccinated get vaccinated. That's what's going to get us to opening fully sooner than anything possible. And of course, part of that is to make sure that everybody has access to the vaccines, that any questions they have relative to the vaccine are answered. So we're pursuing making the vaccines available to everybody, almost everywhere, in an easy fashion through our LouVax mobile operations, which is providing vaccination opportunities throughout the city. So if there's a location that can say we can administer 20 or more people with the vaccine, we'll come. LouVax mobile will come. So we need help with the media to identify what those spots are. Now, just as critical is making sure that we go to every corner, answer every question that we have. It's not enough just to say you need to get vaccinated. Don't you know that? Some people have concerns, and our job is to answer what those concerns are with science and the facts. All of the vaccinations have been obviously based on science. They've gone through rigorous testing. They're safe. And so now we just want to make them easy and accessible for everybody. The progress that we've made here and around Kentucky is one reason that Governor Beshear announced yesterday that he's lifting the curfew on Kentucky's bars and restaurants and allowing bar seating. All this takes place on May the 28th, and that's the same day that capacity on events with 1,000 or fewer people goes up to 75%. So we're seeing a lot of good progress here and around the country. So let's just keep making smart decisions. We are not out of the woods yet, and we can all do something more by mask wearing, particularly indoors or any place outdoors where it's regulated, but by encouraging everybody to get their vaccines as well. So let's take a look at where our local data is. We're going to do that as we do every week with Dr. Sarah Moyer, the Chief Health Strategist for the city and the Director of our Public and Health and Wellness team. So Dr. Moyer, thank you for your good work. Take it away.
Thanks, Mayor. So we are holding steady in that orange zone. We bring up the webpage here, and just a reminder that anyone can check out this data anytime you want. If you go to COVID-19 or LouisvilleKY.gov, click on the resources and the data dashboard, this will come up. 666 cases were identified last week. Majority reported attending events like weddings and funeral, family friend gatherings, sporting events, religious events, proms, musical performances, followed by travel was the second main thing our patients reported. So this is just a really good reminder that if you are not fully vaccinated yet, that's 2 weeks after your second dose or first dose of J&J, please get tested before attending any events like that or traveling to protect your family and friends. We only had one death reported in this last week. This is the lowest death I've reported out since we started having this COVID briefing. So just another look at all the great progress we've made over this last year. And just another reminder too that every single one of these is 100% preventable. We've had 0 deaths in Louisvillians that are fully vaccinated, and so please sign up today if you haven't yet, especially if you're over that 50 age category, where it puts you at higher risk. The number of vaccinations increased last week. We now have almost 47% of our residents with 1 dose. If you do the math, it's about 60% of everyone over the age of 16 in Louisville is now vaccinated with at least 1 dose. So getting vaccinated is quick and easy now with over 150 sites across the city. Majority of these places are taking walk-ins, and some are even offering incentives like Walmart and Kroger with their lottery tickets. So if you're one of the few yet that hasn't signed up, I encourage you to check out our website to see those locations, or go to vaccines.gov to find a site and a type of vaccine near you. For the hospitalization data, there are 82 patients in the hospital as of yesterday, 28 in the ICU, and 17 on vents. And then the last thing just wanted to go over was the demographic data of our cases. You can stop there or slightly farther down. You could see that majority of our cases continue to be in the 20 to 44-year-old category. One more down there, Chris. But 0 to 19 is now the second highest group, and this group had been one of our lowest in the beginning. So that, I think, segues nicely to our special guest that we have on today that the mayor will introduce in a minute. But as a mom of four, I really value the advice and guidance of my pediatricians. So happy to have Dr. Gaines and Dr. Purcell with us today. Looking forward to that discussion. Unfortunately, my kids aren't old enough yet to get the vaccine, even when it goes down to 12, as we are expecting later this week. But I will be scheduling their appointments as soon as that is possible. The quickest way for us to get back to the things we love and not missing out on the things we love, because you might be exposed, is to get as many people vaccinated as possible. And one of the things I keep seeing, especially over these last months, are parents and kids and teens that are missing out on sporting events and proms and graduations because they either have COVID or stuck in COVID because of quarantine. And so just a reminder that if you are fully vaccinated 2 weeks past that second dose, you get out of jail free card there with that, and you don't have to quarantine anymore. So if you need any extra motivation, I think that is one of them. And besides just really helping us to prevent the spread of COVID, protecting our family and friends, especially our older family and friends in the city, getting vaccinated is really the quickest way to help us reclaim the moments that we lost last year. So with that, you can pre-register your teen now, 12 and older, at Norton's website. And you can also, majority of the places that offer the Pfizer vaccine, so if you go to that vaccines.gov and just click on Pfizer, you can see places that are offering it. And so just be ready to go on Thursday when we are hoping that they'll okay it for everybody 12 and older. And as always, any questions, need help navigating the vaccine sign-up process, or if you know of anyone homebound that is not able to travel to one of the sites, please call our helpline at 502-912-8598, and we can help you with that and get you signed up. So back to you, Mayor. Thank you.
All right, Dr. Moyer, thank you very much as well. And as you teed it up, we want to focus on the new news coming out around our 12 to 15-year-old young population that's now going to have access to the vaccine. So for that, we brought on two experts this morning to talk to us about that. First is Dr. Beverly Gaines. She's a pediatrician, president and CEO of Dr. Beverly Gaines and Associates Pediatrics, and Dr. Pat Purcell, medical director of the Kentucky Office for Children with Special Healthcare Needs and a member of the Greater Louisville Medical Society. Both of these great leaders are also members of our city's vaccine distribution task force. Dr. Gaines also chairs the NAACP's Louisville's Health and Wellness Committee, and she has been approved by both state and federal government to administer the Moderna vaccine in her practice. So Dr. Gaines and Dr. Purcell, thank you all so much for being with us this morning. Why don't we just start by giving us the lay of the land. You know, for a lot of parents, naturally, the question is going to be, is the vaccine safe for my children who are 12 to 15 years old? And how do you all know it's safe? So how will you all be approaching these conversations from your respective viewpoints? Dr. Gaines, let's start with you.
Thank you for having me. Ooh.
We got you.
Okay. Thank you, Mayor, and thank you for having me on this morning. I think I always rely on my relationship with my patients. And I think they trust us, and the data shows that patients do trust their healthcare providers. The great news about using Pfizer in this age group is that its profile for safety and efficacy is excellent, 100%. And so I think we will reassure our patients that it is safe and effective. And more often than not, our patients follow our guidance. And we're known to be a practice that promotes immunizations. Patients who do not want to get immunizations as recommended, we encourage them to probably find another medical home.
Very good. And we see that time and time again right now with where we're at with the vaccines. It's like who's going to convince you to get the vaccine? It's not movie stars, it's not politicians, it's not athletes, it's your primary care physician or a doctor that you know. So whether it's adults or kids, it looks like that's the case. So Dr. Purcell, why is it important to be talking about the importance of vaccinating this particular group of our population?
I want to just reiterate what Beverly said, Dr. Gaines. Thank you for having me. This population, well, your slides that Dr. Moyer put on previously alluded to where we're seeing an increase in the population. I think by immunizing this population, there's two things that can happen. One is that we can hopefully return these adolescents to a more normal, and I'm going to put that in italics, lifestyle, where they can go to school, they can do sleepovers, they can have activities, and they can really develop that social context, which is incredibly important for them. The second piece that I think occurs with that also is that by them getting immunized, by them getting vaccinated, it shows a more social context, which I think is incredibly important for us to consider with our adolescents nowadays.
Mm-hmm. And are the primary care and pediatric providers within the Greater Louisville Medical Society now encouraging parents to get the 12 to 15-year-olds vaccinated?
Yes, I would tell you that they are, yes.
Okay. And so, Dr. Gaines, let's flip to the other side of this. This is a newly eligible population, but have you seen children in this age group in your practice with COVID?
Yes, we have had a few cases. Fortunately, they've been very mild cases, children presenting with cold symptoms or intestinal upsets, and we've been very blessed. We've not had anyone that needed to be admitted to the hospital that we're aware of.
Mm-hmm. And so you can have that mild, I guess, presentation in a young person who can give the virus to an older person who then can have a much more significant reaction. Is that fair to say?
Exactly. And even some infections are asymptomatic. A patient may not have symptoms at all. So that makes our vaccination more important, because that way you want to protect yourself from the infection and transmitting it to your grandparents or other relatives or business associates. Yes.
Mm-hmm. And I'm sure you've got some older children in your practice as well, above 15 years old. So have they been receptive to getting the vaccine?
So far, so good. We've had some resistance, which I'm a little, well, not surprised, but a little bit, maybe even a little dismayed at. But generally, we're going very well. We ran out of vaccine last week. We've been ordering 100 or so doses every week, and we've been giving out the vaccination since April 26th. So, but our patients they've been pretty compliant. Now we try also, we can immunize and vaccinate even the parents and the grandparents. Some of them have been a little resistant, but they tend to be more willing to have their children immunized.
Interesting. I can tell you, at Central High School, I was at their event about 2 weeks ago, and I was really impressed by the number of parents that the kids were bringing in, the Central High School students.
Yes.
And they were just saying, we're only here because my daughter or my son convinced me I needed to get vaccinated. They made it easy for me. They brought me down here. So we're seeing some leadership from our teenage population on this, which is very encouraging.
Absolutely.
Dr. Purcell, so what kind of concerns are you hearing in the community?
I think the concerns are probably related to the timing of the vaccine in terms of how long it's been available. I think, as Dr. Gaines said, if you look at the data that's been published so far that the FDA looked at, and you looked at 2,200 children, and of the 2,218 actually contracted COVID, and they were in the placebo group. They did not receive the vaccine. You can see the efficacy is excellent. I think what parents should also recognize is this is an ongoing verification, so to speak. There's 4 different avenues that are being monitored. There is the VAERS, where anyone across the nation can put in a complaint, or they have something that they are uncomfortable with. And so that's a monitoring system. There's the Cessna, which is the monitoring system. So they're constantly monitoring any side effects that anyone has, including the children. So this isn't you get the vaccine. This is, let's follow these children. Let's follow these adults. And so far, everything has gone very well for people.
Mm-hmm. No, it's good to see. So let's, Dr. Moyer, are you still on the screen there? If you could pop back up. Let's see if she's still there, because it's interesting. Okay. So here's a mom who happens to be the director of public health and wellness for the city. 4 kids under the age of 7, I think, right? Just like my wife and I when we had our kids, and my wife's a doctor, and that's a wild scene. So kudos to you for being able to pull off your professional life as well. But you, without hesitation, you said at the beginning of this, as soon as I can get vaccines for my kids, I'm going to do it. So you should know more about this, or practically as much about this as anybody, in terms of moms with young kids and a public health professional. So just share with us why you feel it's safe now.
This vaccine's been probably given to more people than any other vaccine really in across our history, and has been tested greatly over the last year. So just feel really confident in it. I know that it's been a huge stress relief for my husband and I to be vaccinated. And just having our kids vaccinated, I think will even reduce that stress even more and protect them from getting anything. And I know the disease might be mild, but now with being vaccinated, they won't have to miss out on school or sports or anything else as well, and being worried about their exposing other people. So just combined, like, their health, and then them protecting our community and protecting family and friends that might not be able to get vaccinated for whatever medical reason that might be.
And it sounds like an unwavering belief in the science behind the vaccine.
Correct.
And before we go to the media, just let me throw this out to you guys. Why, when the vaccine was approved, when it was approved, why didn't they start at ages 12 and up? So what's different about the vaccine presentation in young people over adults, and why was there additional testing required for that? Who wants to handle that?
I can start. They usually do, Mayor, a gradient, kind of a gradient version in terms of what dosage. That's incredibly important. So right now, the 12 to 15-year-olds are receiving the same dosage as what the adults are receiving, because they are considered somewhat adult-like, and so their bodies can handle that, and that's the appropriate dosage for them, as the 2200 has shown. When you get to the younger children, like Dr. Moyer's children, or even younger, then there has to be a smaller dosage that is distributed to these children. And so that takes more time, and it takes more opportunities to make the choice, what is the dosage that we actually give these children. So there's a time constraint that occurs, so you can't just automatically give, as you can appreciate, a 2-year-old what you're giving an adult. That takes more time. So the companies gradient then how they're going to distribute the vaccine in terms of the amounts.
Okay. And so just a reminder, the vaccine manufacturers are undergoing these clinical trials right now, aren't they, with ages 2 and up? Am I right with that?
I'm going to say I know that they're in the age down to age 7.
Okay.
And I presume that they are working on age 2. I've heard that is what is going on, yes.
So in the coming months, Dr. Gaines, we'll be hearing more about these new categories, I guess.
Yes, I think we're looking forward that we're going to be able to immunize infants and on up eventually. And I think I was just listening to the testimony on the Hill today, and they said that the next studies are underway, and we should have recommendations maybe in the fall. And so then, and I think to answer your other question, Mayor, there is sometimes a conservative approach with children. We will roll out vaccines and we'll test the adult population. and make sure that they are safe before we expose our children. So I think that's a conservative, good approach to let's see how it is. Because when you do a trial, you see how it is in a smaller population. Then when you roll it out into the public, then you see what happens in the greater public, where you're more likely to see problems.
Gotcha. Okay, well, with that, let me just say, we're trying to make sure the vaccine is available everywhere, and maybe we can throw up a slide about the hike, bike, and paddle event, because we'll be vaccinating people down there. Okay, so that'll be for ages 12 and up here at the end of the month on Memorial Day. So come on down and get your shot on, and then go for a hike or bike or a paddle. And you don't need an appointment to make that happen. We're starting to see some good results at some of our clinics where people are just walking in. They say, I don't have an appointment, but I'd like to get a shot now. So we want to make it easy and accessible to everybody. So with that, Jess, I'll throw it back to you so we can go through the media questions with our guests here. So Dr. Purcell, Dr. Gaines, thank you guys for joining us here today. And I'm sure we'll have some questions here for you from the media. Jess?
Okay, thanks, Mayor. Our first question is for Dr. Moyer. It comes from David Mattingly with Wave 3. Dr. Moyer, David asks if you could please repeat the information you gave earlier about the 600 plus current cases and the breakdown of how people contracted the virus.
Yeah, good question. So back to the same data systems we've been working. One of the questions that our contact tracers ask is where have they been the 2 weeks before they got exposed? And so that question for a while after spring break had been really travel. Majority of the cases were reporting travel in the 2 weeks. So possible exposure. Now they're reporting events as the number one. So events are everything from proms and birthday parties to weddings and funerals and derby-like events. So it's a big category, but that now is the number one thing people have done in the last 2 weeks when they've possibly been exposed.
Okay, our next question is for the doctors. This comes from Myra Ansari with Wave. She says, what events can you address concerns from parents that the same vaccine given to adults is the same given to children? Is that any reason to be worried? And do you foresee younger children getting a different version of the vaccine? Dr. Moyer, do you want to kick that off? And then we'll see what Dr. Gaines and Dr. Purcell have to add.
Sure. Going to look to them for their expertise, but most vaccines over the age of 12 is the exact same vaccine as the adults. And then for kids under that, and so I feel very confident with that. It's the same thing for flu shots and other things that like over 12, it really is usually the same dose. Under that, we always want to give the least amount of dose as possible to get that immune response. So kids under that tend to be smaller. And so the pharmaceutical companies are testing, it's the same medicine, but are testing if a smaller amount can have the same effect. And so that's why those trials are going to take longer. I know, I think question earlier, I think Pfizer's got trials going down to 6 months right now. And so the different pharmaceutical companies are testing different doses and different age groups to see like what's the least amount they can give kids and still have a great immune response. And so that's going to take longer. We think that's going to come up in September.
That's exactly right. And I think we have some vaccines like the flu vaccine. At younger children, we give them a smaller dose, but it depends on the science. And I think people are getting a great deal of comfort from the amount of science that we put into this. But the amount of protection for the dose is the most important. They measure your antibody levels as a result of being immunized. And so I think the comfort is, as it is being tested, and we are going to give the least amount with the best outcome, with the best protection.
And Myra has a few other questions, so we'll take those and then we'll get into David Mattingly's Derby questions. Myra asks, what events can kids get back to once vaccinated, and what can parents feel safe doing? Dr. Purcell, do you want to kick us off for that one?
I think that the CDC will probably offer some additional guidance based on the science, but the thought process is that these adolescents will be able to get back to, as I said, a more normal type of activity level, analogous to what we can do now once we've been immunized. So I think looking at having friends and having the opportunities to play sports and having the opportunities to return to school, which again is so incredibly important for their social and mental benefit, I think that's an ultimate goal that parents should choose for in terms of determining vaccinating their child.
Agreed.
Okay. The next question from Myra is, if parents and children choose not to get vaccinated, what should they refrain from doing? And does vaccinating children mean maybe not wearing masks in school eventually?
Well, I'll take a stab at that. I think we always look to the leaders in the educational system, in the infectious disease community, and CDC for guidance. But if you're not vaccinated, then you're going to have to be more careful about where you go. You should always continue, we call them the 3 W's: wear your mask, wash your hands, and avoid crowded situations. And I think in the schools, with the safe distancing that they're using now and the kids getting vaccinated, not too many schools are requiring vaccinations, but some are. I just learned the other day that Simmons College is going to require vaccinations for kids to come back on campus in the fall. And I think that's going to help us boost the numbers as well if there are some requirements. But certainly them getting out into the open space and getting back into the classroom and like Dr. Moyer said, sleepovers and proms. I think they're looking forward to that. And they're safer the more people that are vaccinated.
I agree with that. And I want to add too, if parents are in that thought process of maybe not immunizing their child, vaccinating their child, parents really need to think about the randomness that occurs with this virus. It is very, very random. And that, I think, as a parent myself, is rather frightening to me. I can't predict what's going to happen and who my child is going to get around and what's going to occur. So I think keeping that in mind is incredibly important as we look at vaccinating. It removes that worry about the randomness of this vaccine, of the virus.
And if I could just add, you're absolutely right, Dr. Purcell. And you know, I think that now that the older population is more vaccinated, it has a higher vaccination rate. I just recently read 25% of the cases now are in younger children and adolescents. So I think that's another reason that parents will want to be more proactive in getting their kids vaccinated.
Thank you, doctors. Our next questions come from David Mattingly with Wave 3 News. He has several questions about Derby. So we'll start with his first. He says, have you found anyone who contracted COVID who attended the Derby? And Dr. Moyer, do you want to take that one?
Sure. Yeah. So reminder, people usually develop symptoms like 2 to 14 days after contracting the disease. So we're still in the early stages here collecting data. We have had a handful of cases that did report attending Derby when they were in that infectious period. So doing that contact tracing, make sure people know, but just like we mentioned before, anyone who attended any sort of event, whether it was a big Derby or if it was a party in your backyard or at a friend's house, please get tested. If you have any symptoms right now, and if you didn't get tested last week, it's always a good idea just to get tested if you're not fully vaccinated yet. And if you did attend one of those events, still, it's never too late to sign up to get vaccinated. Or if you're planning on going to a concert or anything else here in the summer, starting to traveling, now's the time to get vaccinated so you can be fully vaccinated and safe to do those events and not have to worry about getting COVID or spreading it to anyone else. So vaccines work, sign up.
Thank you. David has a few more questions about Derby, so I'm just going to lump these together. He asks, have you seen any evidence that the Derby has resulted in any increase in cases of COVID? Can you speculate on why or why not? And if the Derby proves to not be a super spreader event, what could this mean for how future arena and stadium events are handled?
So I think it's a good sign that our cases didn't increase again. Where every week we were getting more and more people vaccinated, and the more people vaccinated means less places where COVID can spread. So I think we're in a different place than a year ago, and so excited about that and why events like Derby and other things can happen. The weddings, they're restarting, birthday parties, all those things that we missed this last year. So I think it's just a sign that vaccines and masks and spacing work. And if you don't have all three, if you at least have the vaccine, that works great.
Okay, thanks. And one final question from David. He's asking if there's a way to quantify how many a handful of cases is who attended Derby.
We'll have to get back to you with the exact numbers, but less than 10 so far.
Okay, thanks, Dr. Moyer. Paul Miles with 840 WHAS asks, is it safe for their children to receive the COVID vaccine at or near the same time as other vaccines that they may be receiving, and how will that work? Dr. Gaines, do you want to take that question?
Sure. Yes, we commonly will give more than one vaccine at the same time. What you have to be careful of is giving a vaccine separated by a very short period of time. If you get a vaccine today, you should not get another vaccine for 28 days. But we commonly, and I unless Dr. Moyer knows otherwise or Dr. Purcell, we can give 2 vaccines on the same day, and it does not affect the immune response or the protection.
The CDC right now is saying no other vaccines within 2 weeks of the COVID shot. So unfortunately, as Dr. Gates said, you can't give the COVID with something else. We think that will change in the future because we know from other things that it's totally fine. We just don't have the data yet. So I think to be safe, recommending no other vaccines within 2 weeks of the COVID vaccine.
I stand.
Yes. I want to also bring up too, we do know as pediatricians in the Louisville community and throughout the United States, there has been, unfortunately, because of the pandemic and children and adolescents not being able to get into their pediatrician's offices easily, we are seeing a delay in some vaccines. So it is important to do the correct timing to get not just the COVID vaccine, but to get your normal routine vaccines, which some children unfortunately now have been delayed on. So taking that's a good question in terms of the timing, because that'll play into getting the COVID vaccine as well as the routine vaccines, which might have been delayed.
Thank you. And our last question in the chat is a non-COVID related question from Katrina Helmer with WDRB News. She asks the mayor, do you know why Louisville's allotment of American Rescue Plan funds was reduced from the initial estimate of $434 million?
Katrina, that is a good question. To the White House's credit, they called before the numbers became public yesterday and advised us our number was going down, as has happened with several cities around the country. So I asked them to get back with us and explain what the difference was, and they said they would do so. So hopefully we'll get a better understanding of that here this week. So it went from, like you say, 435 to 390 roughly, which is a lot of money. So we're not being ungrateful about that, although it's our citizens' money here with taxpayer related funds. And so we have a lot of plans for how to deploy those funds in the community to make some long-standing systemic impact around issues like equity, infrastructure, education, public safety. And so we'll be talking quite a bit about that over the next month or so. But as soon as we find out, we'll be putting out a press statement with the rationale behind it.
Okay, thank you, Mayor. And that is the last question in the chat.
Okay, well, thank you, Jess. And again, Dr. Gaines, Dr. Purcell, thank you for joining us today. And Dr. Moyer, for you and all of your public health team. It's been a marathon we're on here. It's not over. Use the horse racing analogy. We're coming down the stretch, hopefully, and we can see the finish line, but we got to go strong here and do that. So everybody, please encourage everybody to get their vaccines so we can get through this pandemic as quickly as we can. We're really fortunate here in the United States. We're, I guess, probably the leading country or one of the leading countries right now in terms of getting our people vaccinated after a very difficult start with testing. And there's other countries around the world that are really struggling right now. So got to think about them, got to help them, because their health is our concern, because the longer the pandemic rages around the world, the more variants that present themselves, which can lead to other challenges that come on our shore as well. So we're far from over here as a globe, but we're making good progress here locally. So let's stick with it. Thanks everybody for tuning in today, and we'll see you next week. Be safe.